On August 1st, we observed World Lung Cancer Day, and the Health Ministry has reported a recent increase in lung cancer cases in Sri Lanka. The data indicates that lung cancer is more common among men than women. With me now is Dr. Saman Iddagoda from the National Hospital for Respiratory Diseases in Valisara, where he serves as a thoracic surgeon. Thank you very much, Doctor, for your time. Now, what could be the reason behind this sudden spike in lung cancer cases in Sri Lanka?
Yes, Mahesh. In fact, this sudden rise can be due to various factors. Like if we consider the data for the past 10 years or so, when we analyze the data from the National Lung Cancer Registry, there's increased incidence or reporting of lung cancers in Sri Lanka, especially in male population as well as in female population. Now, in Sri Lanka, it is the second most commonest cancer seen in male population, and within female population, it's the 10th highest cancer in Sri Lanka. And this can be due to multifactorial, that is due to various factors, because like nowadays that we have like a lot of screening done in hospitals and patient awareness is there, and then this increasing number of reporting. And again, we think that there's some correlation between the air pollution and reporting of these cases. And I think these are the main factors in increasing in reporting of this lung cancer. At the same time, for the lung cancers, there's a correlation with the family history and occupational exposure. Occupational exposure wise, there are some jobs that people are having some exposure to fumes, chemicals, and I think these sort of people has very high risk in developing these cancers. So I would say the reason for increasing in lung cancer rates are due to various factors, and it's a very big problem currently in the country as well as in the world format.
Absolutely. Doctor, now what are the symptoms for someone to understand that they might be a victim of lung cancer, and how can they get checked?
Again, Mahesh, it's a very, very good question, because if a person is having lung cancer, sometimes they have early symptoms, especially if a person is having cough, which is more than 2 weeks of duration, that can be taken as a red flag sign. But being a tropical country, Sri Lanka, we have a lot of respiratory illnesses. So anybody who's having a cough which is lasting more than 2 weeks, we can't consider it's a cancer. So, but I would say that is one of the commonest symptoms. So I would suggest like cough, if you're having cough more than 2 weeks duration, better to go to your family practitioner or general practitioner and get the advice from a qualified medical professional, and they will direct you if there's a need to a qualified chest physician.
Indeed, that's a lot of good information, Doctor. Thank you very much for that, because if somebody is actually thinking that they might be a victim towards lung cancer, better to get checked rather than it's too late. Well, let's leave it at that. Thank you very much. That was Dr. Saman Iddagoda, a thoracic surgeon at the National Hospital for Respiratory Diseases in Valisara. Appreciate it, Doctor.